Hello, I'm Esme Fuller Thompson. I'm the director of the Institute for Life Course and Aging. We're so fortunate today to have Dr. Sinha with us. Samir Sinha is the director of Geriatrics Medicine at Mount Sinai Hospital in Toronto and the University Health Network. He's also an associate professor of medicine at the University of Toronto. Thank you so much, Dr. Sinha, for joining us. We're looking forward to this discussion.
Pleasure to be here.
All right. Well, so sleep is such an important topic. I just wanted to ask some basic questions. So why should we worry about our sleep? Why is sleep important?
Well, I think for many of us, sleep is a really important part of our days. Often it's at least a third of what we do in a given day, and a lot of people struggle with their sleep as they age, and people just wonder, why am I struggling? Why is this so much harder to do? And how do I get a good night's sleep? Because if I get a good night's sleep, it often means that you're going to have a better day ahead of you. So it's an increasingly common issue that we see amongst many older adults, and it's a common topic of frustration and one that people try and solve in their own ways. And so I hope that today we can speak a little bit more about things that people can do to understand sleeping as they get older, but also things that they can do to improve it.
Wonderful. So we often hear the phrase, get a good night's sleep. What does that look like?
Yeah, I think a lot of people hear about this magical window that everybody should be getting 7 to 9 hours a night, that's what's recommended. But the reality is some people have never needed to get that much sleep. Some people sleep less and feel well rested in the morning, and other people find that they need more than 9 hours, if you will. So there's no one right number in terms of I have to sleep this amount in order to get a good night's sleep. We have to remember that everybody is different, but certainly people who can't, get a reasonable sleep, throughout the night, and so they feel tired and they feel exhausted during the day. Those are people who are genuinely having sleeping issues. And I think it's really important that we first of all recognize that as we get older, our bodies fundamentally change. And it means that our sleep isn't as deep as it usually is when we're younger. So we're more likely to be prone to interruptions, for example, and we're more likely to wake up earlier in the mornings. And when people realize that, okay, it's actually normal for my sleep to evolve as I get older, then I think it really helps people to have a different frame of mind of how they can approach understanding what's realistic and what they should focus on to try and get a better night's sleep.
Okay, but some people actually end up having sleeping disorders. What are some common types of sleeping disorders?
Yes, certainly. I think for many of us as we get older, some of the reasons why we might have trouble sleeping is because, for example, we might have serious medical conditions. We might have things like congestive heart failure, where blood in our body doesn't flow back to the heart normally, and sometimes blocks up a bit in the lungs, for example, and therefore we get some of this what we call fluid in the lungs and makes it harder for us to breathe. Other people might have a condition called obstructive sleep apnea, and that's where we're not actually able to breathe normally, and so sometimes we stop breathing and find ourselves gasping for air as we try and awaken and reopen kind of our air passageways. Those are much more serious conditions that sometimes happen. More common issues, especially during the pandemic, can be things like that we're a bit more anxious or that we're a bit more depressed, and those sorts of things. Mental health issues can make it harder for us to sleep well, and so sometimes we focus on trying to get to what those issues are and how we can better resolve that. And for very few of us, we have those serious conditions that can cause real sleep disorders.
So are there some suggestions you have about how to improve our sleep or protect it?
Absolutely. The first thing we always start off when talking to people about how to improve their sleep or protect their sleep is to really be mindful about something we call sleep hygiene. So it's the idea that when we were younger, we would be more able to have deeper sleep, and therefore we were less prone to easily being awoken through various kind of sensory things that were happening in our rooms, for example. And that's why we talk about a few key things that we recommend all people do. And I used to talk about this all the time with my patients, but it didn't really apply to me. And then after I turned 40, I realized, wow, this really applies to me now. So it's making sure that your room is dark, because if your room is dark, for example, then you less likely have light stimuli that's to awaken your brain more easily, telling your brain, hey, it might be morning, so you might as well get up. We also talk about making sure the room is not too cold and also not too hot. We often talk about that magic temperature of 69 degrees Fahrenheit or 19 degrees Celsius. And by keeping the room slightly cool and dark, it keeps us at a level of comfort, for example, where we're more able to sleep well. We also talk about avoiding any screen time in the room. So trying to make sure that you're not, going to bed with your iPad, for example, or have the TV on and blaring, because those sorts of things, for example, can certainly kind of keep your mind active and stimulated, and then make it harder for you to fall asleep. So we talk about the importance of sleep hygiene. We also talk about things that we can do to try and not interfere with our sleep in the evenings. So for example, things that we often recommend are not having a big glass of water right before you go to bed. Making sure that you're avoiding caffeinated beverages, and also kind of limiting your alcohol intake, because all those sorts of things can certainly interfere with your sleep at night. And making sure your bladder is empty before you go to bed, for example, is one way to make sure that you're not going to be awoken in the middle of the night by a full bladder, and then that's kind of interrupting you and getting yourself up. Last thing we also recommend is that if you have issues like chronic pain, chronic arthritis, sometimes it's the pain that keeps you up at night or will easily awaken you. And so sometimes we talk about people taking some of their pain medication before they go to bed to ensure that pain is not going to be an issue that wakes them up in the middle of the night. So these are some of those basic things we recommend people think about, and things that are pretty easy for people to do, because by doing those things, you're less likely to have an interrupted sleep at night and more likely to have a better sleep and feel more rested when you wake up in the morning.
Oh, great hints. What about exercise? Does that play a role?
Absolutely. I think when we exercise, and our exercise guidelines for younger people is the same as what we recommend for older people. We talk about getting 150 minutes of exercise a week. And this is not pumping iron at the gym or running a marathon. This could be about going for a walk, 5 times a week, 30 minutes a day. Because by exercising our bodies, for example, we keep them, healthy, but also by exercising as well, we're more likely to be more naturally tired by the end of the day. And often people who don't exercise as much, for example, may not actually sleep as well at night. So that exercise that we get during the day can get us more appropriately tired by the evening, for example, and then make us want to have a better night's sleep.
Right. Now, I know a lot of older adults take naps. Does that tend to undermine their ability to sleep at night? What do you suggest about naps?
Absolutely. Napping is kind of evil, if you will, in the sense that if you're a person who's always had a nap and you find you're sleeping well at night, then, I would say continue having your naps. But if you now notice that, when you try and get to sleep at night, or you find that, the sleep you have is kind of, it's not that long, and you're also napping during the day, that could be the nap could be a problem. Because part of what happens in our brains, it's quite fascinating, is that after we wake up, every hour during the day, we kind of have more of a buildup of chemicals in our brain, if you will, that kind of get us more to that need for sleep, if you will. And what actually happens is when you actually have a nap, say in the early afternoon, you almost kind of wipe away those sleep signals, for example, that are slowly building up and that are able to get you to get a good night's sleep at night, because you've kind of cut off that signal during the day. So you're not as sleepy by the time you go to bed, and therefore you don't often have a deep or long-lasting sleep because you already made up for some of it during the day with a bit of a nap. And it's a dangerous cycle, because when you're not sleeping well at night and you feel tired during the day, you're more likely to nap during the day, and then you almost have it where you're sleeping during the day and then you're not even sleeping at night. So naps, if they're not causing you any harm, then that's fine. But if you're finding that you're a person who has trouble sleeping and you're a big napper, then I would recommend cutting back on the nap time, and then making sure that when you are going to sleep at night, go to sleep at a regular time. Make sure that you're waking up consistently at a regular time, and really try and focus on exercise and the other things I just talked about to try and promote a better night's sleep.
So if people have tried all of these suggestions about how to sleep better and they're still struggling, when would you suggest they talk to their family doctor about it, and what might that look like? Might they be sent for tests, that sort of thing?
Yeah, certainly. If you're a person who's having trouble sleeping, often it's just the important thing to, first of all, is just to kind of read up and learn a little bit more about sleeping in older age, and kind of how it's different fundamentally. Because when I talk to many of my patients who've got sleep problems, when they start realizing, oh, okay, well, this is actually a normal part of aging for sleep to not be as great. I get it, right? Because a lot of people have the expectations that I should sleep as well as I did in my teenage years, and that's just not a reality. So when people understand kind of how sleep is different, and that there are things you can do to better modify your sleep, I find most people are able to resolve their issues pretty well. But I do have patients who say, I'm still struggling with sleep at night. Is there something I can take or something I can do? Well, that's important then to identify, could you have one of those underlying medical disorders, for example, like congestive heart failure, obstructive sleep apnea, that needs some further investigation and maybe certain interventions like medications, or if you have obstructive sleep apnea, you might be prescribed a device called a CPAP machine that helps you breathe better at nighttime, for example. But in many cases, sometimes people just have a little bit of what we call insomnia. They're doing all the things that we talked about, and they're still not getting a good night's sleep. And this is where people can start looking at some of the supplements that are out there, things like melatonin, or some of these teas that have that herbs in them, or other things like that, like valerian, for example. Some of these things, for example, can help us get a better night's sleep when those other things aren't working on their own, for example. But I often recommend that if people are going and looking at over-the-counter medications, for example, or want a prescription, this is when you should talk to your doctor first. Because a lot of the medications, prescription and non-prescription out there, things that come under brand names like Sleepies, for example, or some of these things, they seem innocuous. You should take a look at the ingredients they have in them, because often some of these medications have what we call benzodiazepines, benzos. These are things that under the names of like Valium or Ativan, these sorts of things that can actually increase our risk of falling and don't necessarily work particularly well for sleep. And they're addictive, and they can increase our risk of falling. And for those people who might be struggling with mental health issues like anxiety or depression, for example, those may be things that you can treat without medications, but sometimes there are medications that you can use to treat those issues well. And often when you treat those underlying issues like depression or anxiety, your sleep will massively improve as well. So again, this is where if the sleep hygiene things that I talked about, aren't working enough for you and you're still struggling with your sleep, talk to your primary care provider next, because they might be able to help determine whether there are other investigations or tests that need to be done, or they could help advise you whether there are sleeping medications or supplements that you could take that can help you sleep better at night as well.
Really helpful and a wonderful overview. Well, thank you so much, Dr. Sinha, for taking the time to explain this to us, and we really appreciate your insights. We all want a good night's sleep, so that you've given us some great hints about how to do that. Thank you.
Perfect. No, pleasure, and good luck.